blunt truth is that actually there is no way of telling whether your patient is awake or asleep during surgery. What you traditionally did was that you used surrogates for the level of anesthesia by looking at your body's response to painful stimuli, and that was a rise in blood pressure or a pulse rate or sweating, and we determined that, well, we decided at what point this was relevant in terms of patients possibly becoming awake, and we upped the dose of the anesthetic, or we dropped the dose of the anesthetic if all those things are going very quiet. You need an experienced anaesthetist to do that, and junior doctors in training are not as good as senior doctors with years and years of experience. In order to get round that problem, people have tried to look at measuring the activity of the cerebral cortex, for example, to determine if increased activity tells them anything about the level of anesthesia. And the sort of instrument I'm describing is a device called a BIS monitor, or bispectral index monitor, and its introduction has not been accompanied by useful outcomes overall. Some studies have shown that it's beneficial, and other studies have shown it to be paradoxically worse than the traditional techniques that we've used. Your best bet is to have a conscientious anaesthetist who's very experienced. We haven't a physical or objective means yet of determining the level of anesthesia that we can employ on a simple day-to-day basis.